constant progress in CT scanner technology is providing faster, more accurate, and safer image diagnosis. Recent technological advances have increased the feasibility of immediately proceeding with therapy following diagnosis. At the forefront of this trend is Shimadzu, with a new CT scanner for IVR procedures that provides total support from diagnosis to therapy by combining 64-bit technology with other modalities. First, let's look at the clinical application called MC-ACT, in which angiography with an opuscope and CT scanning are carried out in a single examination session. MC-ACT enables quick, accurate testing for hepatocellular carcinoma and immediate follow-up therapy by transcatheter arterial embolization. After first setting up the undertube of the opuscope, CT arterial pertography is performed. A catheter is inserted into the superior mesenteric artery while monitoring the fluoroscopic image on the opuscope, and the patient's couch is moved inside the gantry. A positioning scan is conducted using CT to produce a slice plan. "25 seconds after injection of the contrast medium, a spiral scan is made. The real-time spiral scan function reconstructs and displays the image in just 0.125 seconds, enabling the contrast effect to be immediately checked. Lesions are represented as image defects. CT arteriography is now performed. The catheter is inserted into the common hepatic artery while monitoring the fluoroscopic image on the opuscope. For CTA, the spiral scan commences 7 seconds after injection of the contrast medium. Real-time spiral scanning allows strongly enhanced lesions to be immediately checked. Next, the opuscope is used to perform common hepatic angiography. X-ray exposure is conducted from the CT control room using the hand switch installed on the opuscope. The acquisition rate is 1.5 frames per second over an acquisition period of 20 seconds. High image quality is obtained for patients with a body thickness of 20 centimeters at a low X-ray dose of 74 kilovolts and 3 MAS, thanks to the opuscope's high-performance CCD camera. Based on DSA with the opuscope and the results of CTA and CTAP, a course of therapy is determined. If a decision is made to carry out TAE, transcatheter arterial embolization, safe, accurate therapy is possible, as the location can be precisely determined through selective CTA using a microcatheter. And at a later date, if PEIT is to be performed on a tumor embolized with Lipiodol, CT fluoroscopy can be used to improve determination of the puncture area. Now let's look at some actual clinical images. In this case, intravenous contrast CT gave the impression of HCC recurrence in the S6 therapy region, so MC-ACT was performed. These are slice images from the vicinity of the area treated. CTAP shows an image defect in the treated area. Staining the suspect section enables it to also be checked by CTA and selective CTA. These are slice images from the S4 region in the same case. No abnormality is visible with intravenous contrast CT. But image defects in areas of enhanced contrast can be recognized in two locations, on both the CTAP and selective CTA images. This image is a common hepatic angiogram from the same case. Two areas of enhanced contrast are visible in the region shown on the previous CT image. Now let's look at a second application. CT fluoroscopy can be used to confirm the location of the leading tip of the puncture needle in real time, enabling more accurate biopsy and infusion of anti-cancer drugs as the needle is inserted. Including this large 21-inch monitor for evaluating the puncture location in the examination room, Shimazu's versatile multimodal system is complemented by user-friendly hardware that greatly facilitates examinations, such as a local operator's console with controls for snapshot image storage. Now let's look at the flow of a CT fluoroscopy examination for performing PEIT. The puncture path is set using the Smart Guide function. When the puncture point on the body surface and the target point have been set using the fluoroscopic images, the Smart Guide function displays in real time a guideline showing the point where the needle tip will intersect the slice plane. The operator follows the path marked by the guideline up to the point of intersection, accurately reaching the target point. As there is no need for the puncture point and target point to be on an identical slice plane, the X-ray dose exposure to the operator is reduced, and operability is significantly improved. Let's look at an actual example of how the puncture path is planned. With the patient's couch position controlled from the CT console, the tumor's position and puncture point on the body surface are determined to accurately set the puncture path. The position of the needle tip can be checked in real time, as the puncture image is reconstructed and displayed in just 0.125 seconds. Both the patient's and operator's X-ray exposure is drastically reduced, as the tube current is lowered to a minimum of 10 milliamperes. Using the fluoroscopic image to check that the needle has reached the tumor, anti-cancer drugs are injected continuously. In this case, a mixture of ethanol and contrast medium are injected. These are snapshot images stored during fluoroscopy. Utilizing the Smart Guide function, as shown here, puncturing was performed in a difficult section 1 centimeter below the lung. In this case, a TBLB is required. The forceps are guided by setting the Smart Guide so that it establishes a line from the bifurcation of the bronchus up to the tumor. By advancing the forceps along the guideline, the targeted bronchus is accurately reached. Faster, safer, and more accurate. The application of CT scanners is being broadened from diagnosis to therapy. Shimazu is at the forefront, developing new generations of CT scanners to meet tomorrow's clinical needs, combining powerful hardware supported by 64-bit technology with original software that's a step ahead of the competition. When you think CT, think Shimazu.